Hey mamas-to-be, got that sugar spike? Understanding gestational diabetes. Hey everyone, and welcome back to the Full Hot channel. Today we're diving into a topic that affects many amazing women on their pregnancy journey, gestational diabetes. Now, gestational diabetes might sound scary, but with the right knowledge and support, you can totally rock this pregnancy. So let's break it down. What is gestational diabetes? Imagine your body like a bustling city. Food is like fuel, and insulin is like the delivery trucks. They take that fuel, sugar, to your cells for energy. But during pregnancy, the placenta can mess with these trucks, making them less efficient. This leads to high blood sugar, which is gestational diabetes. It affects about 3 to 10% of pregnancies in the U.S., and while there might not be any symptoms, some mamas might experience increased thirst or frequent urination. So who's more likely to develop it? Being overweight, having a family history of diabetes, being over 25, and belonging to certain ethnicities like African American, Asian American, Hispanic, or Native American can increase your risk. How is it diagnosed? Don't worry, your doctor will likely screen you for gestational diabetes between 24-28 weeks with a glucose tolerance test. It's a simple way to check your blood sugar levels. How is it managed? The good news is gestational diabetes can be managed. Here's your toolkit. Healthy diet. Think balanced meals with whole grains, veggies, lean protein, and healthy fats. We'll have some yummy gestational diabetes-friendly recipe links in the description below. Exercise, regular workouts help your body use insulin more effectively. Even a brisk walk each day makes a difference. Blood sugar monitoring. Keep an eye on your blood sugar with a finger prick test. This helps you and your doctor adjust your plan as needed. Treating high blood sugar. In some cases, your doctor might recommend medication or even insulin injections to keep your blood sugar in check. It's all about keeping both you and your little one healthy. Complications you want to avoid. If left unmanaged, gestational diabetes can raise your risk of complications like a big baby, early delivery, and even type 2 diabetes later in life. Don't worry, with proper care, you can minimize these risks. What happens after delivery? Typically, your blood sugar levels return to normal after delivery. However, having gestational diabetes puts you at a higher risk of developing type 2 diabetes later on, so keep those healthy habits going. Mamas, remember, you've got this. For a list of products that can support you on your gestational diabetes journey, check out the links in the video description below. Don't forget to like this video, share it with your fellow mamas-to-be, hit that subscribe button, and join our amazing community for more pregnancy tips and support. We're here for you every step of the way. For a list of products that can help you get better with gestational diabetes, go to the links in the description of this video. Thank you for watching. And don't forget to check out our website at www.thefullhot.com for even more resources.